1 से 200 तक के क्वेश्चन देखने वाले हैं। ये सिर्फ रीडिंग फॉर्मेट में ही होगा। मैं क्वेश्चन और आंसर रीड करूँगी। One among the following is considered as the fifth vital sign in emergency department. पांचवी vital sign कौन सी है? Response to pain. Pain is the fifth vital sign. The duty not to inflict as well as to prevent and remove harm is fidelity. Normal oxygen saturation level in adult is 94 to 99%. Postpartum hemorrhage is loss of blood which is more than 500. Patient complained about nausea after having food. This type of data is objective. The refractive error caused by the differences in curvature of cornea and lens is called astigmatism. The advantages of using a pen-like insulin delivery device is accurate dose delivery. The notes that are frequently used in nursing education for recording data about students' data on practice is called anecdotal notes. The fundamental aim of plastic and reconstructive surgery is to provide restoration of function and aesthetic form. The client with rheumatoid arthritis may reveal which of the following assessment data. Answer is swan neck deformity of the hand. The transplant of an organ or tissue between two genetically non-identical members of same species is allograft. The total number of sustainable developmental goal designed to achieve a better and more sustainable future for all by the year 2030 is 17. Curve obtained while plotting cervical dilatation in partograph is sigmoid curve. Concept of hospice care is to give supportive care to final phase of terminally ill patient. Communication technique in which repeating to the patient what the nurse believe is the main thought or idea expressed by restating. MEWS stand for Modified Early Warning Score. Appropriate nursing intervention for boggy uterus is massage the fundus. In bacterial meningitis, CSF reveals elevated protein level. Protruding abdominal and tongue, short and broad feet and hands are the symptom of Down syndrome. A nurse researcher is interested in tracing the research activity conducted by prominent nurse lived in a different point of the time. Identify the research approach that suits most for this research, that is called historical. Type of restraint used in a mental health setting. Answer is all of above, in which physical, chemical and environmental restraint included. Next question. As per INC guideline during COVID-19, as per INC guideline during COVID-19, the attendance required for nursing student in in clinical settings is 100% attendance in each practice area is relaxed to 80%. In the following, which is the commonest surgical disorder of the stomach during infancy? Hyperpyloric stenosis. Select one among the following which is not a part of a behavioral therapy. Hypnosis. Hypnosis is not the part of behavioral therapy. The scheme which seeks to drive toward 90% full immunization coverage of India and sustain the same by the year 2020 is Mission Indradhanush. Premature separation of normally implanted placenta during the second half of pregnancy, usually with severe hemorrhage, is known as abruption placenta. A method of negotiation in which employees use authorized union representative to engage in talks with authority is known as collective bargaining. The stage at which the pressure ulcer extends to the subcutaneous fat layer is stage 3. Morse scale, M-O-R-S-E, Morse scale is rapid and simple method of assessing a patient's likelihood of falls. The most common cause of maternal mortality in India is obstetric hemorrhage. The approach with effective continuity and sequence of learning experience that facilitate integration of learning is problem solving approach. Apgar score measures which among the following criteria? Answer is A for activity, B for pulse, G for grimace, A for appearance and R for reflex. QT bundle of care is used for patient with Foley catheter. Fourth degree burn refer to deeper tissue possible involving muscles and bone, that is called fourth degree burn. The research method which collect data at one point in time and draws conclusion, that is descriptive correlational. The process of determining and maintaining competence in nursing practice to uphold the standard of nursing profession is called as credentialing. The normal bilirubin level in neonate is 5.2 mg per deciliter. The separation of person or a group of people reasonably believed to have been exposed to a communicable disease but not yet symptomatic is quarantine period. The sign which indicate placental separation is uterine shape changes from discoid to globular. The model that represent an organization defenses against failure as a series of barriers for analyzing medical error and patient safety incident is Swiss cheese model. The mode for transmission of a swine flu is by, answer is all of above, in which included airborne respiratory droplet, touching contaminated surface and skin to skin contact. The most common used measure of journal quality is impact factor. Sclerosis of Long bone may suggest osteoid osteoma and sclerosing osteomyelitis. The synthesis of messenger RNA from DNA, the first step in a gene expression, is called transcription. The shock, which occurs when blood volume is abnormally displaced in the vasculature, is in distributive shock. Sterilization by moist heat at temperature less than 100 degrees Celsius include in pasteurization and vaccine bath. The single most important practice to reduce hospital associated infection is hand washing. A 2-year-old child with dengue shock syndrome and apnea is brought to the emergency room. The first step of procedure required for this child will be bag and mask ventilation. Overvalued idea where the patient believes one aspect of his body is abnormal and deformed is called as dysmorphophobia. The first management to be used for treatment foul smelling bed sore is metronidazole. When performing chest compression on an adult during 1% CPR, you would deliver them at the ratio of 30 gem-2. Nosocomial infection is most commonly caused by Staphylococcus aureus. Donning referred to putting on PPE. Blood lithium level of more than which unit is often associated with toxicity? Answer is D, more than 2 MeQ per liter. The ideal route for administration of drug during newborn resuscitation is umbilical vein. The charge nurse is making assignment for the next shift. The patient assigned to fairly new nurse 6-month experienced, pulled from the surgical unit to the medical unit should be a 72-year-old who needs teaching about the use of incentive spirometry. The outward expression of the genetic constitution of an individual is phenotype. The most common risk to patient privacy and confidentiality is an organization's employee. The patient have difficulty in smelling. Nurse assess for which cranial nerve. The answer is cranial nerve number 1. A visualization tool for categorizing the potential cause of a problem in order to identify its root cause. Answer is fishbone diagram method. Priority of planning in nursing process is based on Maslow's hierarchy of human need. MR-SOPA is used when there is ineffective ventilation. Standard management for a patient with deep vein thrombosis include maintain bed rest. The purpose of using WHO ladder approach in cancer patient is pain management. Model, objects, specimen and dioramas are considered to be three-dimensional aid. The body investigated to receive complaint on a sexual harassment at workplace is Internal Complaint Committee. The population served by subcenter in a plain area is 5,000. The phenomena of occurrence of two or more genetically determined alternative phenotype in a population is called polymorphism. A multidimensional practical examination of clinical skill which is used as a tool for assessing clinical computation. Answer is objective structured clinical examination. Often we called it as a OSCE. Disorder of localized increased bone remodeling, most commonly affecting the skull, femur, tibia, pelvic bone and vertebra, is Paget disease. All are true about dietary advice for cancer prevention except हम डाइटरी एडवाइस कैंसर पेशेंट फॉर कैंसर प्रिवेंशन क्या एडवाइस देंगे तो वो देख लेते हैं. एक्सेप्ट वाला लास्ट में देखेंगे क्या हम एडवाइस देते हैं. तो रिड्यूस इंटेक्ट ऑफ डाइटरी फैट, इंक्रीज इंटेक ऑफ डाइटरी मिनरल्स, मॉडरेट कंजप्शन ऑफ स्मोक्ड फूड, ये हम दे सकते हैं. और क्या हम एक्सेप्ट में क्या आंसर आएगा कि reduce intake of dietary fibers. Deliberate design and implementation of structured innovation, new policy, goal of change in operating philosophy, climate and style is termed as planned change. Feeling as though the world is distorted or not real is called as derealization. In case newborn shows sign of asphyxia at birth, the nurse should immediately clear airway. The smallest amount of glucose that is considered safe and not caustic to small veins while providing adequate TPN is 10% glucose. The process that renders data into number that can be entered into database is coding. Root cause of analysis is a method of a problem solving that mainly focus on sources. Comprehensive individualized care provided by the same nurse throughout the period of care referred to primary nursing. A common misconception about counseling involves giving direct advice to client. A child is diagnosed with Wilms tumor. During assessment, the nurse in charge expect to detect an abdominal mass. A lesson plan should be based on the following. Answer is all of above, in which included all option. Operational philosophy of the teacher, teacher's understanding for his or her student, teacher's knowledge of the teaching method and material to be taught. As per the INC guideline, the minimum education requirement for MSc Nursing admission shall be passing BSc Nursing, BSc Honours or PBBScN with 55%. In polio vaccine, while inner square of VVM, that is vaccine vial monitor, is lighter than outer circle, it means use the vaccine. Unexpected event that result in patient's death or physical or psychological injury is sentinel event. The statistical process of analyzing and combine result from several similar study is meta-analysis. According to the Bloom taxonomy, the lowest order of thinking is knowledge. The width of confidence interval decrease as the sample size increase. The research study that look backward and examine the exposure to suspect risk or protection factor in relation to an outcome that is established in the start of the study. हम लुक बैकवर्ड करते हैं तो ये स्टडी क्या कहलाएगी? रेट्रोस्पेक्टिव स्टडी. द नर्सिंग डिलीवर्स नर्सिंग केयर इन हेल्थ सर्विस थ्रू. Answer is all above, in which included phone triage, interactive video, remote telemarketing. In the following organ, the excess iron is deposited due to hemochromatosis. Answer is all of above, in which liver, heart and pancreas. Sudden onset of abnormal involuntary movement, purposeless in nature, is termed as tic disorder. AV fistula after anastomosis of artery and adjacent vein is ready for dialysis after 6 to 8 weeks. Ejection of milk is known as galactokinesis. General representation of relationship between things in given phenomenon is theoretical framework. An exact written report of conversation between patient and nurse during the time they were together is called as a process recording. A situation in which larger percentage of a problem is subclinical, unreported or otherwise hidden from view is called as iceberg phenomenon. Two contradictory ideas or reaction towards some or a same object which makes person unable to take decision is ambivalence. The 3 R's of solid waste management are reduce, reuse and recycle. Network analysis in management of health service include PERT, P-E-R-T, PERT. Plant alkaloids that cause metaphase arrest by inhibiting mitotic tubules formation is Winkrist time. The state of necrosis, analgesia, relaxation and reflex loss is anesthesia. ओके, हमने 100 कवर किए, बाकी के 100 नेक्स्ट देखेंगे.